Here at Insource, we specialise in data management solutions for the NHS. We help organisations harness the power of their disparate data to drive better patient outcomes, streamline operational efficiencies, and extract essential insights from across the hospital or complete ICS.
Insource's background in working with the NHS is over 20 years. And with that 20 years of experience, we've touched many key areas within the NHS, both at trust level, at ICS level, and national level more recently. We've dealt with community care, mental health, cancer, all the specialist areas and units. So we've applied that knowledge that we've gained over the last 20 years.
Our groundbreaking technology brings all the detailed information on a patient's complete care journey, previously locked into various IT systems across the ICS, into one place. This accurate single version of the truth can then be shared by clinicians and managers for system-wide care coordination and better patient care.
So what Insource bring is firstly a very strong and reliable data platform. So we bring together data from all the different IT systems that are involved around the hospital, and there are many, many of those, into a completely clean and consistent unified data layer that all of the clever analytics and intelligence and all of the other things that you need for managing patient pathways can then sit on top of that unified data layer. With that prerequisite, you can then set about tackling waiting times, not by firefighting the symptoms, but with continuous and reliable processes that address the root causes of long waits.
Over our 20-year history, Insource are delighted to have become trusted data partners right across the NHS. We cover many sectors, including acute hospitals, cancer centres, maternity units, ambulance, community and mental health services, and independent healthcare.
The NHS at the moment is trying to integrate, and it's in a hurry to do so. Healthcare has previously been operated fairly much in silos in England. So you have acute care, community care, mental health, and then you have social care completely separate. The integrated care systems bring all of this together. And when you're managing an integrated system, you also need integrated data. And that's where Insource come in.
I've known Dr. Rob Findlay, who works with Insource for many years now, and he's devoted much of his working life to finding the best ways of organising waiting list treatments. Insource also has some groundbreaking technology. Where the NHS has boxes that don't talk to one another, Insource is focused on the data architecture and how, through what they call a unified data layer, they can make sure that all the different parts of the system can share information for the benefits of patients. So it's a combination of good technology and people that are focused on what the NHS is really all about. It's patients.
At Insource, we are immensely proud of our NHS expertise, and we fully support the government's Data Saves Lives strategy. We are committed to making the huge wealth of NHS data easily accessible to frontline staff, so they can improve efficiencies across the service and make the best possible patient care decisions. With Insource, you can be data confident.